when you see a doctor, I always recommend one of two things. The ideal is both. Bring somebody with you. It's amazing how we as cancer survivors don't hear all the time exactly what's being said. I can't tell you how often I've gone into a meeting with my wife and I come out and I say, well, isn't that great? Doctor said so-and-so, and she said, no, he didn't say that. And as I think back, after I get feedback from her, I realize that more often than not, she's correct. I'm under a lot of tension, and when you go into a doctor, if you're the survivor, you're under a lot of tension. And sometimes our memory and our perceptions of what happens in that meeting is not as accurate as we would like it. In the ideal situation, bring a tape recorder to your meetings. There are some people who advocate hiding the tape recorder or using their cell phone. I don't think that's fair to a doctor, but I also, I like to ask the doctor, are you okay with recording it? I am a little hesitant with a doctor who has an objection to that because I want them to be careful in what they say to me and what they recommend. Ask the doctor how many times they've done a particular treatment, especially if you're thinking of your radiation or surgery as a primary treatment. There's a lot of evidence that the more experience a doctor has in using a treatment, the better the results and the less side effects. So ask the doctor, how many surgeries have you performed? How many do you do each week? And make sure it's a very robust number. Ask the doctor what their opinion is about using off-label drugs. A doctor can legally do that, and make sure that you're okay with whatever their opinion is. Ask the doctor what clinical trials may be available and what's their attitude about, recommending and helping you get into a clinical trial that may make sense. And the most important part, find out from the doctor by asking them, what do you see my role in making treatment plans and decisions going forward? I think it's important to learn how to manage your doctor and how to manage your insurance company. Managing your doctor, to me, means making sure that they see you as a person, that they don't just see you as the patient in room A. You have to personalize your experience so they know who you are, and that takes a little bit of effort. Share the fact that you have children or grandchildren. Bring a picture. Talk about their accomplishments. Talk about what you do. Make yourself a person to them. You're going to get better attention. And with your insurance company, you can do the same thing, but you also have to let the message be known if you have an issue over a payment or reimbursement, that you're going to be there and you're going to fight them, that you're not a person who's just going to go away and they're never going to hear from. Because that's important, especially as we move on to the more advanced treatments.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.